Hi, everybody. It's Kim Bergen-Jackson, Administrator at Oak Knoll, and I'm recording on October 5th for your viewing pleasure on the 6th of October. So by the time you viewed this video, we will have our booster clinic influenza clinic at Oak Knoll East completed, because that's today. So there are lots of things going on, so I just thought I would go over things one more time. I know that you've read a lot about it and that you're planning already, but the 6th of October is our booster clinic, the COVID booster by Hardig Pharmacy. It's in the Hayden room from 1 to 5. Laura O'Connor is coordinating that for me because she's awesome and amazing, as you all know. So you should be planning to come like you did for the flu clinic in alphabetical order and follow Laura's directions, because she's the boss tomorrow. Hardig's never been here before, so I'm excited to use a local pharmacy, and I hope that we do 400 shots over the next 2 weeks. So maybe more than that, maybe 600. I don't know. Anyway. We also updated guidance last week, so you know that you're no longer required to screen in, and your visitors are no longer required to screen in independent living. We moved those kiosks to the licensed areas, so we're still utilizing the system outside of assisted living in the health center. So if you don't live in the health center and you don't live in assisted living, you still need to screen in when you visit. I know that's annoying and time-consuming, but that's the rule right now. You're considered a visitor to the state and the federal government. To me, you're not a visitor, you're just part of one big community, but they've never actually figured out how to put us in a grouping accurately. So the screening kiosks are located at the health center entrance, at the old main entrance, second floor, Oakcrest, at the assisted living door, and then at the maintenance doors coming into the health center. So very handy at those doors if you want to visit somebody in the health center and assisted living. In addition to screening in, we're asking people to continue to wear masks. The county transmission rate that's available to me is still considered substantial in Johnson County. And since we're entering flu season, we think it's a good idea to just keep our masks on for a little while longer. So I'm sorry, I'm saying the COVID rates continue to go down in the county, which is great news. I'm very excited about that and kind of anxious about it going back up around the holidays, but so far so good. Please get your booster. That is a proven method of at least preventing serious illness in most people. So the COVID booster, I'm hoping, is the last one you'll get this year, and maybe they'll do it annually soon. So that booster is available on 10/6 and 10/13. That is the new bivalent booster. So it will cover the variants that are, prominent. The old boosters are no longer available. They've retired them. So you don't have to ask for a new booster. You just have to get a booster. If you can't make the 6th and the 13th work for your schedule, I understand. Walgreens and Hardig Drug and I believe Hy-Vee are all scheduling appointments to get this booster. Many of you have already gone and gotten yours. I already have had mine. So I would encourage people to go to those locations if that works. If it doesn't work and you can't seem to get boosted during any of those times, let me know. Public Health has committed to giving us a small amount of Pfizer and Moderna when we need them to have our own clinic, possibly in November, for people who don't catch the wave right now or have had COVID recently and want to wait. So keep me honest on that and remind me. I said we would do a small clinic ourselves sometime in November before Thanksgiving and any traveling starts. There's also new guidance on testing. So we've been providing testing in independent living because we had ample supply. Those supplies are going to dry up, and we're not going to be able to provide the rapid tests that we've been doing soon. I don't have a date when that will stop. I'll tell you that the CDC no longer recommends asymptomatic people being tested. However, if you have an exposure, which is within 6 feet of somebody who has COVID without your masks on for longer than 15 minutes, then you can talk to the apartment nurse about testing availability and see if we have any tests available. That current recommendation is day 1, day 3, and day 5. There is no more recommendation to test on day 10. If you get COVID, you can stay in your apartment for 5 days. That's a decrease from what we've been doing, and then come out of your apartment for the next 5 days wearing a mask. I would ask you not to eat in the restaurants for the entire 10 days because you could still transmit COVID when you're positive. Speaking of COVID positivity, we have no residents in the health center or assisted living with COVID right now. We only have 2 residents in independent living, both at the main campus, not connected to each other, and a small handful of staff. I think 2 people recovering from COVID right now. Sometimes people sneak past me, and I want to make sure I include everybody. So I think it's 2 and 2. Those are great numbers. I anticipate we will continue to see a small handful of positivity throughout this fall season. No influenza cases, which is great. I love fall. It's cold. It's lovely. The leaves are changing colors. I wish we were on the East Coast so we could see all that colors in the leaves. Football is upon us. And life goes on. So enjoy the activities and the events we have planned. I didn't bring any today to tell you about, but things are happening. And next week, I go to Denver on Thursday. So I'll be gone in 2 weeks, but I'll see you when I get back. If you have any questions, please don't hesitate to reach out, and have a great week.